Hello, welcome. My name is Adrienne Delorco, and every Wednesday at 2 p.m. Eastern, we bring you expert interviews on migraine, wellness talks, yoga classes, and I'm thrilled this week to bring an expert interview with a dear friend and headache specialist who I met at Headache on the Hill this year, Donna Ionel. I hope I said it right. I should have checked that first. I was really thrilled to be able to work with Donna in Washington, D.C. We were in the same group. She was representing Kentucky. I was representing Idaho. And I loved her energy. And she was so helpful in even coming to meetings she didn't have to go to for our state, to just lend her expert presence and be able to answer questions, to just really advocate for headache patients. So I'll share Donna's little bio, and then we're going to really focus today in this episode on seasonal allergies and migraine, and all the different incarnations, whether it's sinus headaches, trying to suss that all out. So Donna is an assistant professor at an academic hospital and a headache neurologist. She completed her medical school at Kansas City University of Medicine and Biosciences, followed by her neurology residency and headache fellowship at the University of Kentucky. She is passionate about headache advocacy, and I absolutely saw that at Headache of the Hill. And she was a participant in the Patalucci Advocacy Leadership Forum through the American Academy of Neurology, and participated in Headache on the Hill. And when she is not helping patients, she enjoys cross-stitching, playing board games, and spending time with their family. So Dr. Donna, we're so happy that you could be here with us today.
Yeah, thank you for inviting me. And I'm thrilled especially about this topic, because this is something that I hear all the time, especially because Kentucky is probably one of the worst states for seasonal allergies. So this question about, is it my sinuses, is it migraine, comes up a ton. So I hope that we can maybe debunk some myths, maybe make some solutions today.
All right, well, yeah, let's start off there. How do you help patients separate what's what, whether it's sinus headache, is the seasonal allergies aggravating migraine? How do you figure out what the difference is? And can we have multiple headache symptoms and sinus and allergies happening at the same time?
Yeah, so what I'll say is that I feel like a lot of times, by the time that I see folks, it's folks that already know that they have migraine, or at least know they have bad headaches. And allergies are maybe contributing. I will say that I think a lot of times people maybe go to ear, nose, and throat doctors, or to their primary doctors, thinking it's all sinus, and don't know they have migraine. So I hope there might be some people listening in on this call that maybe are one of those, that maybe we can tease it out a little bit better for them. But the way to kind of distinguish between the two, there's a couple different things. So with a sinus headache, usually that's coming because there's a lot of inflammation in the nose or in the sinuses. So we have a few sinuses. They sit kind of above our eyebrows, behind our eyes, and kind of down behind our nose and along our cheeks. So we'll start kind of with that for anatomy. So a lot of times when you have a sinus infection or you have really bad allergies, what'll happen is your nose will get really stuffed up. So what happens is the tissues in your nose kind of swell up. That's what makes it so hard to breathe. And then what a lot of people feel is pressure. So they'll feel pressure in the face, pressure in the forehead, and then sometimes even pressure down into the teeth. As opposed to migraine, which a lot of times the pain is kind of here and up, not so much on the face. Now, of course, there's exceptions to everything, but one thing is, again, kind of location. So if the pain is mostly in the center of your face rather than on one side of your head than the other, or on your head, kind of the forehead and back. Another thing is the symptoms that go along with sinus or allergy symptoms. So having the congestion, having a runny nose, your eyes being really itchy and watery. While those are things that can happen with a migraine attack, those are usually things that they're rarer with a migraine attack. And if you're going to get them, it's kind of later into the migraine attack, maybe when we're in the acute phase or the headache phase, rather than kind of beforehand. So some people with allergies will start to feel the watering or the stuffiness before the headache starts. So
Okay.
timing can help a little bit too. And then the other thing is how the pain is described. So a lot of times if it's sinus or allergy related, people will feel mostly like pressure on their face. So pressure, a dull pain. And again, migraine, of course, has many forms, but for the most part, we think of migraine as throbbing or pulsing, kind of like our heartbeat in our head. And so that can help sometimes too, is saying, well, is it just really a lot of pressure and it's dull, but it's not, a horrible pain, it's just annoying,
Yeah.
versus are we down and out for the count? And
Right.
another thing too, speaking of being down and out for the count, is all the other symptoms that we get with migraine. So our migraine attack. So the light and sound sensitivity, nausea, vomiting, having spinning sensation, being dizzy. Those are things that are not very typical if you have a sinus headache.
Great. So I think, yeah, that's awesome to clarify the sinus headache versus migraine. Now, for a lot of people with migraine, they know they have migraine, they've been had it for decades, and then they also notice that their allergies maybe seem to worsen that. Is that common? Do people kind of go through seasonal cycles where with their allergies, their migraine worsens as well?
Definitely. So definitely when pollen counts start going up. So usually I guess it kind of depends on where you live, but most of the time
Mhm.
it's the spring and the fall for people. We definitely can see a surge of worsening headaches of any type. And
Mm.
the other thing is that allergies can trigger migraine attacks too. Doesn't happen to
Mm.
everybody, but allergies can trigger migraine attacks as well, because our nasal passages and our sinuses are lined by the and supplied by the trigeminal nerve, which is a nerve that contributes to why we have migraine too. So sometimes if we're, really plugged up, that nerve gets irritated. You have a sinus headache and then it turns into a migraine attack, or you
Mm.
get a migraine attack maybe a day later when, the body's trying to adjust to what the heck happened in the nose. And then another reason why we think that allergies and migraine uh, can happen together. Sorry, I'm having a hard time finding the word I want.
You
Why
got it.
that can happen together is that when you have a lot of allergies or when you have a sinus infection, you get a lot of immune cells that get released in your body. Your body's trying to stay normal
Mhm.
while it can't, because the allergies are flaring and everything. So your body pumps out a bunch of immune chemicals and then pain chemicals too. And one
Mm.
of those chemicals that can get released during allergy flare-ups or sinus infections is actually CGRP, which we
Really?
know, yeah, which we know about CGRP from the medicines that we use for migraine to block it. So
Wow, I did not know
yeah,
that connection.
yeah, and so it's
Okay.
actually a lot deeper than we think. So it's not just we're stuffy here, so then the head starts to hurt. It's that our body is kind of going through this immune storm
Yeah.
and the brain is trying to react. And if you're predisposed to migraine, sometimes it's just a little bit harder to um, kind of fight that body's way.
Yeah. Yeah. So there's multiple layers, whether it's okay, activating the trigeminal nerve, more CGRP, maybe just, and then you mentioned, spring and fall. Sure, we've got different pollen count changes and weather systems changing for a lot of people that can,
Correct.
the barometric pressure can affect. So we had a question from Kathleen in our group. So how can people with migraine survive the allergy season? How do you help people through this, especially like you said, where you live? This is a common occurrence.
Yeah. So what I'll say is it is always best to check with your own personal doctor too, but something that so either your primary care doctor or your neurologist or headache neurologist, but really a lot of times what it comes down to is if you know that you suffer from seasonal allergies, you might need to ask your doctor or consider taking like an allergy medicine every day. Again, always
Mhm.
ask just to make sure it doesn't interact with the other things that you are taken for any other conditions that you have. I think someone else had asked about Flonase too. So when I say allergy
Mm,
medicines, there's pills that you can take, there's nasal sprays that you can take. But the reason I bring up talking to your doctor, usually your primary care doctor, about it too, is that sometimes people's allergies are so bad that you actually might need to get sent to an allergist, which is a special
mm,
type of doctor that will test you for all kinds of indoor and outdoor um, allergens. And then you might even need allergy shots
mhm,
because those are a little bit more of a kind of stronger or somewhat more permanent solution to allergies than taking an allergy pill. So I think that treating the allergies before they get really bad, and also things like avoiding triggers. So for example, if you know that every time you go outside to like mow the lawn, you're going to get a bad migraine attack or a really bad sinus headache doing something like wearing a mask when you go outside to mow the
mhm.
lawn.
Yeah.
So anywhere you can avoid triggers, similar to what we do with migraine. And then talking to your doctor about whether you need something like a specialized doctor or allergy shots, especially if it's triggering a lot of your chronic symptoms, I think is important.
Yeah, thanks for sharing that. And in our group, there were actually a few people who recommended and they found a lot of benefit from getting tested and getting the allergy
Yeah.
shots. So, yeah, so it sounds like of course, making sure you're treating migraine, but to help prevent the migraine, treating the allergy
Mhm.
symptoms, strong, being consistent. It sounds like it's not just a one and done thing, like maybe
Correct.
through a certain season, maybe a month or two, like needing more allergy medication. And that
Correct.
is typically, I mean, that's not contraindicated. That's a pretty normal thing
No.
for people to need to take. Yeah.
Correct. Yeah. The only reason I always bring up talking to your primary care doctor is because I think sometimes with anything, we get in the habit of thinking if something's over the counter, like it's probably safe to take, which,
Sure.
we think of that with medication overuse headache, but also with even allergy pills, we might just think, well, we can just go buy, whatever allergy pill. But if you have other problems like high blood pressure or something else, you always just want to check. So that's why I
Mhm.
always bring up talking to your doctor.
No, yeah, definitely check with them. And we had a question from Carrie. She kind of had a bunch of different symptoms. So how do we treat a regular headache, sinus headache, allergies when we have migraine? And I think her question was really about like spacing out, the medication, and is there guidelines on like, oh, I took, my Flonase, I took this, I took my triptan, how to just suss it all out, if there's any advice you can share on how to treat multiple things going on at one time.
Yeah. So here's what I'll say, and here's the tricky part is that when you have multiple types of headaches, you want to be really careful that you don't end up taking too much so that you don't make your migraine worse by getting something like medication overuse headache, or medication adaptation headache is another name for it. So really, there are no set guidelines. I think probably what a lot of us would recommend, or at least what I would recommend, is if your headache is turning into a full-blown migraine attack, please treat.
Mhm.
We know that the earlier that you treat, the better we might do the rest of the day. So the better the chances are of being less disabled. And if if it's a milder headache, and again, it's very pressure-like, it's mostly sinus congestion, it's just kind of annoying, but not a full-blown attack. Just try to be careful that you're not going over this, like too many days per week. Usually we say 2 to 3 days per week of pain medicine for any type
Mhm.
of headache to avoid
Okay.
getting that rebound. And the other way to think about things too is that if every time you're getting a lot of sinus congestion, you're getting a migraine attack, it might be time to talk to your doctor about if you need an allergist, or even if your migraine prevention needs to be increased during those seasons,
Mhm.
or if it needs to
Okay.
be increased in general so that we're less prone to react to our triggers, or the
Yeah,
body
that's a
is
good
less prone
point.
to react to our triggers. Because sometimes, and we know this with migraine in general, you can't always avoid your triggers. You're not
Yeah.
always going to sleep 8 hours a night, and you're not always going to, drink however much water a day, so if we can't be expected to live a perfect life, so that's where medicine helping us kind of comes in.
Yeah. And especially with something like weather, where it is
Exactly.
one of
That's
the ones we have the least control
yes,
over.
correct.
And then Kimberly asked about kind of the interactions between like allergy nasal spray, like Flonase, and then sumatriptan nasal spray.
Yeah.
Is there any issues? Is it affecting sinuses negatively to be using
Yeah.
the one for migraine?
So I really liked this question because this goes back to anatomy and is something that I think we don't sometimes as doctors explain very well, which is that when you use a spray inside your nose, the spray stays in your nose. And again, our sinuses are deep. So when you spray something, it's not actually going into your sinus. It's just staying in that nasal cavity and getting absorbed by the blood vessels in your nose, getting absorbed by the tissue in your nose. So I think the question was kind of about, is this going to damage my sinuses that I'm using two different types of nasal sprays? And it's probably not damaging your sinus because it's not going that deep, like into your body. It's kind of staying right here. It's not going again deep behind or into those bony cavities. However, here's what I would caution, and this is something that like the pharmacist where you get your medicines can help with too, is just the timing. So you don't want to take your spray, if you can avoid it, you don't want to take your sprays too close together because basically, let's say you use your Flonase at like 9 o'clock and in the morning, and then, it's 15 minutes later and you want to take your sumatriptan because your nose has just been sprayed or kind of lined with one medicine, you might not be absorbing the other medicine as well.
Okay, so
So
that's kind of looking at how to space out meds. That would be
yes,
one to
yes,
space
which
out.
of course is hard because migraine is unpredictable.
Yeah.
But the only way that I would say that they would interact is that you might not be absorbing as much if they're taken too close together. And I think
Got it.
normally, again, it kind of depends on the medicine, and which is why I say you could always ask the pharmacist when you go to pick it up. But normally it's recommended that it's about 1 to 2 hours between you spraying different things just for absorption
Got
reason.
it.
But again,
Great.
it depends on the medicine too.
Yeah.
So
Thank
it's
you
not
for
harmful.
clarifying.
Yes, it's not harmful, but you just might
Yeah.
not be getting the same benefit. And so if there is a way to kind of avoid using them too close together, might be a good idea.
Yeah. So, where you live, what times of year and how long do you see these allergy seasons? And I've also, with the climate change and everything, I think there is evidence that pollen seasons are worsening, getting more severe and longer. I'm just curious from, your work with patients, if you've noticed a difference over the years or, when people are really getting hit with this.
So here in Kentucky, it seems to be most related to rain, not in terms of the barometric pressure, but in terms of after it rains, everything's like coming up from the soil. And unfortunately, I hate to say this because I don't want to freak anyone out, but Kentucky is so bad it'll rain the whole summer. So a lot of times people will really be in rough shape from like March until October or so. But
Wow.
again, it varies by state, it varies by
Yeah.
person. And that's
Yeah.
why I
That's a
say I
good
don't want to
point.
freak anyone out because
Yeah.
not everybody that has allergies is triggered, but into their migraine attacks. But it can last months, which again is why sometimes the answer is actually treating the allergies, not just treating the migraine.
Yeah.
Because here
Yeah. Well,
it
that's
can
a
be
really
pretty
good
bad.
point. So yeah, so pointing out, right, it's very dependent on where you live, all the weather and changes.
Yeah.
And so when you're saying like it rains and then is it pollen coming up from that or is it mold
Yes.
or yeah, what do you
I think it's mostly pollen. So when
yeah.
everything is wet, I think again, I guess this is not very scientific because I don't know that I fully understand the whole
Yeah.
rain
Yeah.
pollen cycle, but it seems to
Sure.
be after periods of rain, the pollen counts are usually higher. And my
Interesting.
guess is that it's just kind of soaking everything up and breaking everything. If somebody in this
Yeah.
group is some type of geologist or meteorologist,
Right.
please comment if I am wrong.
Yeah.
This is just what I've personally noticed in my
Yeah.
patients is that it seems to be the worst in springtime because that's when it seems to start to rain. And then
Yeah.
unfortunately in Kentucky, it'll rain all summer long. And so
Yeah, but
things
just to
usually,
point out how long it can last. Yeah.
yes. So it really, again, it can really be disabling. And I think that this too, the other thing is that I would hate for anybody to get into a habit where they just blame their migraine for everything, and
Mhm,
so,
mhm.
which I think we do. We didn't share on this call, but I had shared with Adrian that I'm somebody that also has episodic migraine. So I am well aware of how sometimes I blame myself for things too that I really shouldn't. And I
Mhm.
hate saying that as a migraine doctor because I would never ever do that to my patients. But then when it's me, I'm like, oh gosh, what did I do today?
Sure.
But I think it's important to say to show again that sometimes we can't just blame everything on migraine. Sometimes there are other factors like weather, allergies, other problems going on that need to be
Mhm.
addressed too. Because
Yeah, and I think it gives an explanation too. If someone observes like, hey, most of the year I'm fine, but like every spring my migraine is just coming out of nowhere, and it leaves people kind of like, what am I doing? What do I need to do? And trying to find those patterns. I mean, I think that's why migraine diaries can be so helpful, is you can see these patterns year after year, notice other symptoms, and maybe like you said, it can be okay to perhaps have more of a preventative during these times of year. It doesn't have to be permanent. You can kind of cycle in and out as you work with your doctor.
correct.
So maybe just to recap, for
Mhm.
ways to help people with migraine through the allergy season, knowing they absolutely can affect migraine, reducing our exposure to trigger or to like whatever is creating the allergy. Um, Simple things I've heard also, maybe you can verify, like running the AC, having like an air filter,
Yes,
even wearing
definitely.
like an N95 mask outdoors,
Sure.
can be helpful.
Mhm. Yep.
And yeah,
And
the
these are
more
all
we
things
can.
to try. If they don't work, again, it's okay. But like
Mhm,
Adrian said, these are things that you might want to just try. I don't, not everybody has to necessarily, blast their AC or wear a mask when they
mhm.
go outside, but these definitely are things that could help just make it a little bit easier on you.
Yeah, and if it is very persistent, getting allergy tested and helping your body acclimate, perhaps with shots. Well, great. That was so enlightening. I hope people watching this, have some new tools and understanding of how seasonal allergies affect migraine. What is a sinus headache? How all these things can trigger migraine, and how we can help our migraine by helping our seasonal allergies. Thank you so much, Donna. It's been such a pleasure talking with you, and we can't wait to hear more of your expertise in future episodes.
Yeah, thank you so much for having me. And like I said, I hope this helps somebody. So
It absolutely will. I have a lot of clients and people in the migraine group that have these questions, and will be very grateful to have answers. Thank you.
thank you.